we've had a business relationship going back to 2010. And, as Mark and I continue to have discussions in terms of how can we do things more strategically, it was clear as CVS Health was, moving to become more of a healthcare company and getting closer to payers. Mark had a similar strategy in terms of getting closer to the customer. And it's really the perfect time to bring these two companies together to create a new healthcare platform that can be easier to use and less expensive for consumers and really create a new front door to healthcare in our country.
And Mark, you have talked about wanting to get closer to consumers. You're talking about a situation now where you have more than 9,700 retail stores and minute clinics, too. How many minute clinics are out there?
We have about 1,100.
OK, so that's a way to reach your customer. What do you plan to do with those?
Well, if you think about what the consumer thinks about healthcare, it's the highest line item budget in their household budget today. And it's the most confusing system that anyone could use. So think of an idea where we have 10,000 new front doors to the healthcare system, where people can walk in, where they can ask for some help, get guided through the system. We can make the insurance the back room of the operation. We can waive prior authorizations. We can waive copays as people use the system in a way that's more effective. So we can reduce costs. So it's simpler, it's customized for the individual based on what they need, and it's cheaper.
And all of these things will take you how long to implement? How long before a customer has a different experience walking into a CVS?
Becky, upon closing, there's things that we'll be able to do, out of the gate. And at the same time, we'll begin to pilot these concepts. We'll learn from them. And I would expect within the next couple of years, you'll see a dramatic change in terms of, the store being not just about products, but also service offerings that, can help people on their path to better health and really work as a complement to the medical community, the physicians, in terms of ensuring, that those consumers are following the care plans that their physicians have laid out for them.
Larry, we've talked about a lot of reasons that this makes sense for CVS. We've talked about the pressure coming at the front end, the retail end from Amazon, the pressure at the back end, the pharmacy benefits managers, just from people looking for ways to kind of cut cost and focus on that. Is that what drove you to look for this, too?
Becky, it's really about meeting this unmet need that, Mark was talking about. You look at, the healthcare economy is now, $3.5 trillion and continuing to grow at, what everyone recognizes as an unsustainable pace. And, we think we have the opportunity here to begin to bend that cost curve and at the same time help people achieve their best health. You look at chronic disease in this country today, about half of all Americans have at least one of those chronic diseases. It's accounting for 80% of the healthcare costs.
That stunned me when I heard those numbers, 80% of the costs.
And there's billions of dollars every year on unnecessary and avoidable spending because people are not following those care plans. We can make a dramatic improvement in terms of, getting people back on a path to better health.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.